Hello, my name is Tyler Ryan and I'm going to be presenting Chapter 8, Patient Safety Tools Integrating Quality and Managing Risk for the Healthcare Risk Management class. Okay. Injuries and lawsuits. Injuries and lawsuits are more common in the healthcare industry due to accidents or malpractice. Some studies show that there has been an increase in healthcare lawsuits due to the increased amount of new attorneys graduating from law school each year. Injuries and lawsuits from 2004 to 2006 caused healthcare facilities to pay approximately $8.8 billion due to medical errors. Challenge of prediction. Prediction can be difficult in the healthcare industry or the particular facility since not many employees know which physicians have been sued and which have not. The risk manager of the healthcare facility knows exactly which physicians have been sued and can predict which physicians may need help pertaining to improving their practices at the facility. Predictive models. Risk managers use statistical models in order to predict medical professional liability claims for each individual physician. Even with using this model to predict, risk management education to physicians may not reduce the number of claims, but payouts may be less since physicians will become educated on the claims in order to defend them. Patient safety and medical error reduction. Reducing error in risk management is given a high priority in the healthcare industry. Patient safety and medical error reduction is extremely important since it reduces the number of claims that might involve patient safety or medical error. With keeping our patients safe and having zero medical errors or just a slight decrease in it, it keeps the facility running smoothly and allows the risk management department to succeed. Incident reporting and tracking within the organization. Incident reporting and tracking is not only extremely important to the facility, but also the risk management department. The risk manager needs to know of all incidents reported in order to track each case and conduct follow-ups with patients in order to see how they are doing overall. Also, with incident reporting and tracking, it is critical or crucial for the risk manager to know of every single incident since it allows them to keep track of employees who may have been injured and may need workers' compensation for the particular incident that occurred. Healthcare acquired conditions. Although healthcare facilities have housekeeping teams to keep all areas of the facility clean, certain conditions still may be contracted from being in the facility in the healthcare industry in general. Even if you had the flu shot, you still may get the flu due to an increase in patients with the flu virus. The Center for Medicare and Medicaid Services is now holding hospitals responsible for healthcare acquired conditions. The 12 categories of healthcare acquired conditions are foreign object retained after surgery, air embolism, blood incompatibility, pressure ulcers stages 3 and 4, falls and trauma, catheter-associated urinary tract infection, vascular catheter-associated infection, manifestation of poor glycemic control, surgical site infection, mediastinitis following coronary artery bypass graft, surgical site infection following certain orthopedic procedures, surgical site infection following bariatric surgery for obesity, and deep vein thrombosis and pulmonary embolism following certain orthopedic surgeries. In outdoor prevention communication. Communication is key when reporting incidents to the risk manager. The risk manager needs to be aware of all incidents that occurred in the healthcare facility. Physicians who use more effective communication techniques or resources are less likely to be sued, since the physician is spending quality time with that specific patient. With improving communication in the healthcare facility, patient satisfaction will increase drastically. Managing expectations, informed consent. When a patient clearly understands the risk, benefits, and alternatives for their treatment, they are more likely to accept the outcome, with giving the physician their informed consent for the procedure to be conducted. Informed consent is an important tool used in order to make the patient aware of and understand all risks and benefits associated with their particular procedures or treatment. Informed consent is basically a mutual understanding between the physician and patient. Disclosure of unanticipated outcomes. The disclosure of unanticipated outcomes is a mandatory procedure in the healthcare industry today. It is extremely important for the patient to understand the outcomes that are not expected. If information is not disclosed and the patient is unaware of a potential outcome that is not expected, then it can lead to a malpractice lawsuit against the healthcare facility. All unanticipated outcomes must be disclosed to the patient. Injury reduction. Reducing injury in the healthcare industry is obtained by devising a set of preventions to abide by in a healthcare facility. Unfortunately, preventable harm still accounts for more than 100,000 deaths in the United States each year. Risk managers need to implement and develop plans to reduce the amount of injuries that occur in the health facility each year. Enterprise risk management. The role of enterprise risk management is to look at the entire organization and the effects of risk. Risk management programs and interventions on the different components of an organization into its overall structure. With looking at the organization as a whole and determining risk management strategies that actually work, risk managers will have exceptional knowledge as to what needs to be done and how to specifically do it in each given situation that involves a risk. 7 categories of risk in enterprise risk management: operation or clinical risks, financial risks, human capital risks, strategic risks, legal or regulatory risks, technological risks, and natural disaster or hazard risks. The risk management process. The risk management process is directly related to problem solving in the healthcare industry. This process is a method for organizing the risk-related activities in order to ensure that the best solutions are utilized. 5 steps to the risk management process. Identify and analyze the exposure to loss. Examine the feasibility of alternative techniques such as risk financing to pay for losses. Selecting the apparent best techniques for the given situation. Implementing the chosen techniques to solve the issue. Monitoring and improving the risk management program. Quality management. Quality management is a management process for monitoring and evaluating quality issues followed by changes in the healthcare system. Quality management as well as risk management are focused on the continuous improvement in healthcare. Always improving will help the healthcare industry succeed. The 3 working premises on quality management. Quality is important and can be measured. People are a critical part of the solution and not necessarily a problem. Change is fundamental and always present, but change can be managed to improve any organization. Total quality management. Total quality management focuses on the entire system and not the individual. Management must take full responsibility for the entire problem. Total quality management is primarily the central importance system of the customer. 5 approaches to total quality management. TQM is a positive strategy and should be implemented in the organization's strategic business plan in order for the organization to grow. Excuse me. Top management must be highly involved in the TQM process of the organization. TQM is a complete process with steps and not a program. Quality improvement levels must be applied to all levels of the organization. Quality improvement benefits everyone, both internal and external audiences of the organization. Quality assessment. With quality management comes quality assessment. Risk managers must make sure that the quality of care provided to all patients is equal, fair, and honest. Quality assessment is a formal, systematic program by which care rendered to patients is measured against the established criteria. Quality assessment continued. With assessing quality measures, the continuous monitoring of systems is necessary to ensure that problems are identified early and appropriate intervention is initiated. With continuous monitoring, risk managers will be able to conduct quality assessment measures that are taking place and identify measures that may need implementation or prevention in order to solve issues. Changing management. Since healthcare organizations are in a competitive environment to gain a patient's trust in receiving the care or treatment they need, organizations need to devise new management strategies that tell the customer that this particular organization is the best of the best. The 4 strategies to changing management: system design and operation, problem solving and improvement, knowledge sharing, developing high velocity skills, and others. Barriers to quality management initiatives. There are many barriers or obstacles that risk managers face when implementing initiatives to employees in the organization. The most important barrier that risk managers face when initiating processes is the number of simultaneous programs that are currently in progress. Projects can be difficult to complete if a risk manager has multiple projects in progress. Risk managers should work on a few projects at a time in order to stay focused and complete each project in a timely manner. Focusing on the customer. As risk managers, we must focus on the customer in order to make sure that all needs are met while they are receiving our services that we provide to them. Use this process in order to focus on the customer. Identify the customer, determine needs of customers, develop a process to meet those needs, and transfer the process into an operational activity to conduct. Performance improvement. The performance improvement sector of quality management pertains to how well the organization performs when focusing on customer needs or services. Leadership priority setting, systems approach towards improvement, measure capability, learning organization, improvement capability, and culture. Programs, evaluation process, and questions. These 3 questions should be asked when developing a program to evaluate the risk management of an organization. What are the areas of responsibility or functions defined to risk management within the organization? Which information or data are collected and available within each of these areas of responsibility or functions? Can this information or data be categorized and analyzed systematically to derive measures of effectiveness over time for each responsibility or function? Quality indicators in quality management. These 4 indicators identify areas of concern that need to be further investigated and tracked over time. Prevention, inpatient, patient safety, pediatric. Cost of risk. Risk and responsibilities in a healthcare organization can be costly and are divided into 4 categories: hazard risks, operational risks, financial risks, and strategic risks. And here's the question of the video or presentation. What are the barriers to quality management? Thank you very much.